In today's health, you can get the smile that you want to without a lot of pain. This morning, we're going to find out exactly how from a man who says he can help you in that area, Dr. Robert Castledine, founder of the Arizona Mini-Dental Implant Center. Good morning, Dr. Castledine. How are you?
Good morning, Stephanie. Good to be here.
Let's talk a little bit about the types of procedures you're talking about. You're talking about a person that needs what done to their teeth?
We're talking about replacing teeth with implants. We're talking about retaining dentures, loose dentures with implants. There's a lot of misinformation out there about different types of implants. I used to do the traditional root form implants, and the challenge I had was a lot of times, most times, there just wasn't enough bone to do the implant.
Because it's a pretty big drill you were mentioning.
It's a big drill. Let me show you, Stephanie. This is the drill that is traditionally used to do a traditional implant, what's known as a root form implant.
I may even do this, pull it up like this. I mean, that thing is pretty significant.
Yes, it is. And so many times, like I mentioned earlier, I just could not get an implant in without doing things like bone grafting and more invasive procedures. Now, this is the drill that I use for a mini dental implant.
That's almost the size of a needle, literally.
Right. Now, I brought a replica of a human jaw, and I can show you the difference in the size of the hole between the two.
Okay, so
it's
the
what
hole
I call
on the left.
big hole, little hole.
Okay, yeah, left, big hole.
Big hole on the left, little hole on the right.
That is really, really dramatic.
It's dramatic. According to the FDA, they describe dental implants in a category of replacement prostheses. The difference between the regular implant and the mini implant is 0 according to FDA requirements. In other words, the mini implant is just as strong, it won't break. A lot of misinformation, like I mentioned. I hear people come in after consultations with other providers saying, well, those mini implants break, or they don't integrate, or they don't stay in the bone as well as traditional implants. That's not true. The success rate for the mini implants is around 98%. For traditional implants, it's around 95%.
What about the products that you use for a traditional versus a mini?
Yes, they're both the same product. They're surgical grade titanium, and titanium is titanium. The reason I think that root form implants got so big is because early on, 30 years ago when research was done, they were trying to find a replacement for a root. A root is a certain size and length. Well, roots are made out of a material called hydroxyapatite. The implants are made out of titanium. So titanium can be made extremely strong and with a smaller size. So slowly but surely, implants got smaller and smaller to the point where now the mini implants can do everything that a traditional implant. In the last year and a half, I haven't done a traditional implant because I can't find an application for one.
Right. I mean, why would you want to put that huge drill when you don't have to?
Exactly. Especially when the result is going to be the same. Now, the other thing with traditional implant, big hole implant, is that it takes 6 months for the bone to grow around that implant. With the mini implants, I put the implant in, we put a temporary crown on it, the patient comes back in 2 weeks, they have their tooth. If I'm retaining a denture, I put the mini implants in. I either retrofit the patient's denture to stabilize it, or we make a new denture.
Okay. Well, Dr. Castledine, I appreciate you kind of explaining the logistics of how this works. I think it's great when people, and particularly patients, can kind of be informed about the decisions they're making when it comes to their health. So thank you so much. Appreciate that.